An issue tonight that is much more important to the American people than many realize is Medicaid. Now, for folks who don't understand this, and that's and you really have no need to unless until this health care debate began, but if you will, there's three types of coverage for folks who have insurance. One is Medicare, and Medicare is the program for folks who are typically 65 and above. It is the program that all of us pay into, having a certain amount deducted from our paycheck, and it goes into this account. The second is private insurance. 90% of Americans have their private insurance policy through their employer. And then the last group is Medicaid. Now, Medicaid is a program designed to support those of lower income, as well as those who are elderly and, again, of lower income in long-term care, think nursing homes. And lastly, it supports the blind and disabled. The financing of Medicaid comes from your tax dollars, but it can be your tax dollars either funneled through the federal government, paying a portion to the state, which is matched by what is called the state match, which is from the state itself. So Medicaid is a program for lower income, which receives about, on average, 57% of the money that goes towards it from the federal government and 43% on average from the state government. And the state administers the program to take care of, again, low income for acute medical services, long-term care, think nursing homes for the elderly, and then the blind and disabled. And tonight's discussion will be about Medicaid. Now, the importance of Medicaid is that 16% of the health care dollar in the United States goes towards Medicaid. So almost a little bit over 1/8 of the money our country spends is on this combined federal-state program that provides health insurance, if you will, for the poor. Additionally, Medicaid is important because right now, Medicaid is consuming an ever larger portion of both the federal government's budget as well as the state government's budget. One example of this, the Simpson-Bowles Bipartisan Debt Commission, which President Obama appointed to help give guidance as to how our country could get out of our indebtedness, pinpointed Medicaid as one of the drivers of our national debt. So first, we know that on a national level, Medicaid has been pinpointed as a driver of our national debt. On a state level, Medicaid is consuming an ever larger portion of state budgets. Now, there's many examples of the importance of this, but as Medicaid is costing more and more, state dollars for other programs are less and less. Senator Lamar Alexander from Tennessee said that the reason that tuition is increasing at universities in Tennessee is because there's less public support. More tax dollars are going to Medicaid, and so therefore to make up the budget for the universities in Tennessee, they have to increase tuition. One example of this as well for K through 12 is that for the first time beginning around 2009, states spent more of their income upon Medicaid than on education. And so this is a chart from the National Association of State Budget Officers, and it shows how total state spending on Medicaid now surpasses K-12 education, and K-12 is kindergarten to 12th grade. So this is primary and secondary education. And in this blue line, you see funding for education, and you can see the percent of total state expenditures devoted to, in this case, education. And so in 2008, it peaked at around 22%, and now in 2011, it has decreased down to roughly 22%. Now, it isn't as if this is something that is temporary related to the recession. This is actually expected to continue to worsen. So Medicaid, again, the program that both the federal and state governments, which means both taxpayers paying to the state and taxpayers paying to the federal government, finance, is growing so rapidly that it is cannibalizing the rest of the state budget. An example of this is that expenditures for primary and secondary education now, for the first time in history, are lower than those expenditures for Medicaid, and this is expected to worsen. So, if you will, we have this program, which is important. It's a safety net program, but under its current construction is costing more and more. This is combined federal and state spending. By 2017, this rises to $750 billion. By 2025, obviously within our lifetime, it'll rise to close to $1 trillion, and projections are by 2081, it'll be over $4.5 trillion. Just to emphasize, Medicaid is an important safety net program for those folks without means. It was traditionally designed to take care of the blind and disabled, the elderly and long-term care, and then oftentimes focused upon pregnant women and upon children. So the importance of making sure the program is sound is that we continue to care for these people. I think the point being made is that not only will the safety net become tattered in of itself, but rather, even though tattered, it will destroy all these other important governmental functions, our ability to finance these other governmental functions. We know that under the President's health care proposal, that Medicaid, a program which right now is driving federal indebtedness and which is threatening to bankrupt states, was greatly expanded. Despite that, was greatly expanded under the President's health care proposal to include people up to 133% of federal poverty level. I'll say that I just out of pride of authorship, there's another alternative, a Republican Medicaid proposal, one that I and others are sponsoring, and it does, if you will, similar to the block grant, but it readjusts as your population changes. I'm from Louisiana. When Hurricane Katrina hit, we had lots of folks who moved to Atlanta and moved to Houston. If you will, the dollar would follow the patient. It wouldn't just stay in Louisiana. I love my state, and it would be nice to have the extra money, but it's more important that where the patient is have the money. But it's a variation on the theme, but also part of it is that the state has flexibility, freeing them from the money-consuming regulations that the federal government puts on how those monies are applied. When folks say, well, wait a second, it's Medicaid and the government will pay for it, or the state should enroll because the federal government is going to pay so much more. And there's a sense that it is the government that is paying for it, but not the taxpayer. Now, what we know is the government is nothing but an aggregator of our pocketbooks.
That's right.
And it will take that money and bequeath it.